I remember the day. It was January 24th of '07, and I was at my mom's house. At that point, my husband and I lived alone with our children in Littleton, and we were up visiting my mom. And I was up in her office, and it was just me and the kids there. She hadn't got home yet. And he was sitting in his car seat, and I looked down, and he was blue, and his eyes were doing funny things, and he was gasping. What is going on? So I picked him up, and I settled him back down because he was crying. And I settled him back down and put him back in his car seat. My mom came home, and he did it again. So I called the emergency room, told him they were coming, and when we got there, he did it again. And then they called Dartmouth and said, we have a little boy up here that has seizures, and we don't know why. They did some blood tests and some other things. They shipped him by ambulance to Dartmouth.
I think we shared her sense of urgency because this was a beautiful baby and very happy in between the episodes, but he was having them very often and didn't respond to standard doses of standard medications at all as expected. And I think part of our role was to reassure his mother that things were going to be okay and would be discovered and dealt with.
They were hoping that the medicine would stop the seizures, and the medicine didn't help. He actually just gradually got worse and worse. The doctor said that he should be fine, that the seizures were not causing any damage, that many children have seizures and many people don't know why they have seizures, and it is sometimes never curable, and we never know the answer. And he would hold his breath and go blue, and I would call the doctors and say, oh my God, what's going on? And they prescribed Diastat and diazepam to give him to bring him back down. And we would do that 2 or 3 times a day, and he was still having many, many seizures. The discovery of the hotspot was exciting and scary. We had an answer, at least somewhat of an answer. It wasn't a full answer because they still didn't know what had caused the hotspot, but they were able to locate the hotspot. And we talked with Dr. Morris about surgery and the next steps and the ketogenic diet. And so we said, let's try the surgery. So we talked to Dr. Duhame, and she at that point decided that she wanted us to try the ketogenic diet first. She was willing to do the surgery, but needed us to give the diet a chance.
They were the kind of family that you love dealing with. And the reason is that you could talk to them. They basically had the attitude that we were on the same team with them around Jacob's care, that we were there to help them, and that they believed in that, and that they trusted that we would listen to them, and we really tried to respect that trust that they had in us.
He was on the diet for a total of 2 months, and I think it was about a month and a half, and we went back to the doctor, Dr. Duhame, and said, this isn't working. We need to further pursue surgical options.
We have a very nice working formula with all the child neurologists, which is their job is to help solve the part of the equation which says what could be helped with respect to control of this epilepsy by an operation. How likely is it that an operation will help? Our role is to say what kind of harm could be done? What are the risks to doing an operation?
We saw improvement for, I think, a few weeks, and then we went back to the doctors for his normal, I think it was a month checkup after surgery. And said, it's okay, but it's not great. He's still having seizures.
The first surgery is designed to try to find out where the seizures are coming from. Once Dr. Morse can look at the results of those recordings, which happen over days or even sometimes weeks, he will figure out, with his expertise, where in 3-dimensional space on this brain those seizures seem to be arising from. Then we can tell the family from that data, if we remove or disconnect a specific part of the brain, what's the likelihood that that will help the seizures? What's the likelihood that that can cause harm? So that was step 2. Once we knew that, we decided to take a sort of intermediate approach. We knew that the seizures might be coming from a broader area, but it was safe for him to try to remove or disconnect this back corner of the brain where the seizures seemed to be most strongly arising from. And that was step 2. And that worked great, but only for a short time. Then we had to have a long conversation with the family about the consequences of disconnecting the entire half of the brain. And that was a procedure that we thought had an excellent chance of working to stop the seizures, but at a price. And the price was that Jacob would be left with permanent weakness.
It absolutely has affected his development. He is left with a right side weakness.
Children can recover to some degree, but he would almost certainly be left with weakness in his hand. But we thought he would regain the ability to walk and to use the arm, and he would be spared that constant downside of those continuous seizures that could affect the good side of his brain.
His right hand and his right leg are mobile, but not as mobile as his left side. He has a right side field vision cut, so he can only kind of see half of everything. And he's made great adjustments to that. And he has physical therapists and occupational therapists and speech therapists that come in every week. They each come in a different day. So we have therapists 3 times a week. And he's making great strides. And he's just amazing. He's my hero. He really is.
Jacob is seizure-free, which is a thrill for all of us, and most of all for his family, his mother. He has shown tremendous developmental milestone achievement and gains, which has been the part of Jacob that they had seen a bit of and wanted to see more of, and I think was really what was the best result of the surgery.
I can remember being scared and wanting to try everything that we could, but also wanting to make him better, and he was regressing with seizures. He wasn't gaining anything. He would sit and watch the world go by, and now he interacts with the world.
He has managed to gain back most motor skills as well. He gets around quite beautifully in a fashion, and it's just been a fantastic result.
For other families in this situation, I would have to say, be persistent, be strong, be your child's advocate, because there's no way that the doctors can know unless you tell them. And your children can't tell them. You have to talk for them.
He's doing exactly as you would predict, which is that he has weakness, which will be permanent, of that hand. From his family's point of view, that was a small price to pay for getting Jacob back. And when I say getting Jacob back, they can speak better than I can about this, but what Dr. Morse says is absolutely true. A child can now learn, he can develop, he can progress. He is not on all of these medications that are making him sick all the time. His spark comes back, and this is exactly what this family wanted, and I think it's the best possible choice they could have made. It isn't possible unless you have teamwork, and the teamwork includes all the people that are behind all of the tests and evaluations that these children require. It requires somebody with Dr. Morse's expertise and that of his colleagues. It requires a surgeon who's willing to take this kind of risk on with the family, but most importantly, it takes the family, and the family that's willing to put aside the fear that families have to face when they go through this kind of procedure in the long-term best interests of the child.
And I should add that the pathology, so after the surgery, what came out was very abnormally formed brain, and would have certainly continued to plague him with seizures for as long as he had that in there. He'll be able to walk.
He'll be able to run. He'll be able to chase you.